We are joined by Dr. Richard Audas, Professor of Health Statistics and Economics at Memorial University of Newfoundland and the lead methodologist of the MLI COVID Misery Index. Dr. Audas, welcome to Forum Daily, sir.
Thanks very much.
So what led to the creation of the COVID Misery Index, and how is it put together?
Well, yeah, it's an excellent question. I mean, I think one of the things that we've been sort of looking at over the last year is the fact that this is, we've all talked about how COVID-19's impacted us all pretty severely. And we actually thought it would be really a useful idea to try to quantify that, actually sort of look at, try to measure how it's affected people and look at what we can learn from it, how we in Canada compare to other countries and potentially what we could do better in the future.
And now the question everyone's waiting for, where does Canada stand in this COVID Misery Index, sir?
Yeah, not great. 11th out of 15. So it wasn't a stellar performance for Canada. And interesting, I think that the public health response has been pretty good. I think generally speaking, the disease hasn't hit as hard in Canada as it has in certainly the U.S. or a lot of the Western European countries that were particularly hard hit at the outset. But we don't do nearly as well as some of the Northern European countries. New Zealand, Australia, again, and Japan all do much better than we do. Where we really fell short in Canada, I think, is we've been very slow rolling out a vaccine, and again we've really kind of opened the coffers and really sort of let a lot of money flow out the door to keep it going, and unfortunately that's money that's going to have to be paid back at some point.
Now, to be honest, that doesn't really sound like a very impressive ranking, Doctor, but are there any factors that maybe Canada did well in? I know you measured various factors in this report. Did we do better than any other countries in any of these factors?
Oh, for sure. Yeah. I mean, certainly, in terms of the impact of the disease, I think the public health response has been pretty good. To be honest, my sort of, my read of the situation has been that, that we've done, quite well. And where we fall down a little bit is when we've actually not listened to the public health officials, where we've started opening up maybe a bit too early, and the disease has come back. But I say by and large, the impact of the disease, while has been awful and terrible in Canada, not as bad as it has been in other places. So pretty good there. Again, I think, a little bit short on vaccines and of course, and the amount of money we spent is amongst the highest in the world on a per capita basis.
And in terms of the economic hit in Canada compared to other countries, what do we know so far about the damage to our economy?
Well, it's been pretty severe, and certainly, there's I think the latest unemployment statistics that came out just this week suggested a drop in unemployment, which is really good. I mean, one of the problems that we have with unemployment is the longer people are out of the labor market, the harder it is to get back into it. So there is some scarring effects that we do worry about if people are out of the labor market for a prolonged period of time. And certainly, the Canadian economy hasn't bounced back as quickly as some others that have really rebounded fairly quickly. So real concern there, and of course, real concern that the amount of public debt that we've taken on is going to be being paid off for a very, very long time, and it's certainly going to limit our capacity to deal with the future crises, whether there are another pandemic, climate crisis, or any a sort of standard economic crisis. Those are the sorts of things that we'd worry about, that we've kind of limited our capacity to do work in the future.
All right, Doctor, a little over a minute left, but I know you've been examining other countries, wealthy nations. What are some of the highest ranking countries on this list overall, sir?
Yeah, well, Norway and New Zealand do tremendously well. I mean, certainly in New Zealand, the disease hasn't had as strong an impact, and by and large, they've been able to open up and go back to doing normal activities fairly quickly after a very sharp lockdown when the pandemic first hit. So I think that was the one lesson. Again, Norway, sort of a slightly different circumstance. I mean, essentially, they're sitting on an enormous sovereign wealth fund, and they were able to use some of that wealth that they've accumulated to basically, to buy their way out of the problem. So they were able to avoid a lot of the worst economic effects, and again, a lot of the worst disease effects as well. So they definitely didn't hit as hard there disease-wise, and they had enough sort of money in the bank basically to ride the storm out. So they've done they'd planned for something for an emergency, and not knowing what it might be, but by accumulating an enormous amount of sovereign wealth, they've been able to essentially to ride this out.
All right, Dr. Audas, we are out of time, but thank you so much for joining us on Forum Daily, sir.